The Living Well in Communities team is supporting Scottish Government with their policy called the Strategic Framework for Action on Palliative End-of-Life Care, and that policy is really there to help health and social care partnerships test new approaches to identifying people who have a palliative care need, and also to improve care coordination of that care.
Palliative care, as in every other community, has always been something that we need, but it's also been something that we've needed that was accessible to our particular group of patients here. We've had situations where you knew if we had something like a palliative care bed, we could provide something better for our patients close at hand.
This service has been developed in Demellington to address the need of the local people. So people who were in need of additional palliative care and support in this community would normally be admitted to the hospital, which is about 14 miles down the road.
Probably for a lot of these people in this community, that, you know, it's quite a deprived area. Poverty is a major thing. It's not everybody that has access to, you know, travel, have a car.
It is evident for us as care providers that it is not out of this realm to suggest that a nursing home would be a good place to provide this. The practicalities is you have nurses on duty 24 hours a day. You've got a homely environment which isn't as clinical as a hospital to make people feel more at home. It's in the locality, it's local people who work here, it's people often the patients will know and have grown up with, and it also, and more importantly, you have their family and friends that come just down the road to be fit to visit, often a number of times a day if they so wish.
The staff originally were quite reluctant to have the extra training because they do a lot of training, but actually since they've had it, they've all really enjoyed it, and I think it's opened their eyes to lots of things that they didn't think about, and it's all been very positive.
The palliative care training was great, but it's trained me not just for palliative care, but some of the things that they taught us can be used for not just palliative patients. It's from like pain management and symptoms of pain and how to manage these, and I just think it was really interesting, and it's really helped improve my practice.
I know that in providing the education as well, we measured how they felt about their knowledge and skills before they attended the session and then afterwards. And we could see from the results in that evaluation there was a definite change. And the staff as well are more confident, which is why I think there's a reduction in those contact with the GP and the district nurse for that additional information and support.
There's no extra work for us having a patient in the glebe. It's actually a lot easier for us. We don't have the stress, probably the worry of the patient no coping, the symptoms. They're in the glebe and very comfortable. GPs, district nurses, social work, myself, we can refer into the bed, and that process, if the bed is available, is usually, in my experience, quite prompt. The step-up process for the bed would be a referral from the community, so the patient's at home. At the hospital huddles, it's also discussed as a possibility. So for patients who are in hospital, it could be used as a step-down bed.
The partnership working between the primary care team has always been very good, but I think since having the palliative bed, that's just emphasised that, and it's brought it all together a lot better, a lot tighter.
Improvement science is really important. It has been in this work. It has shown how the collection of data and measurement has been really important in showing the evidence that something has actually worked. And I think when you saw the variety of people who used the bed, who benefited from it, and the fact that we were able to change that stigma, I feel like, that palliative care is about dying. They didn't die here, they were discharged back home. And we were able to show that in some of the patient stories.
Well, I came here first to see how my partner Beryl was doing, because she'd been transferred here after a seizure, and although she wanted to stay at home, it wasn't possible to look after her properly anymore. So she came in here, and she liked it here because it was so local. She only lives about 3/4 mile away, even by car it's not much further than that.
Well, Margaret still has regular visits from people because of mainly I think because of the convenience of being able to come, and also Margaret's in familiar surroundings. She can look from the window and be familiar with what's around her, so it can only be good.
The financial benefits are the pounds and pence that we have saved by patients coming to be looked after here in the community in a palliative care bed versus the cost of an acute care bed in the hospital and all the transports, etc. involved with it.
I think we've shown here in East Ayrshire that there really is a good balance of developing local initiatives that are cost effective but have some significant benefits for both the people delivering that care and receiving it.
I'm really excited about this service because I think there is potential. I know there's potential to spread it within East Health and Social Care Partnership, but I know that the other partnerships are also interested, and it would be such a wow factor to see other people taking it up throughout Scotland.
We are really proud of the palliative bed and what it's done for everyone, what we've achieved with it, and hopefully that it will keep going and we'll keep giving that high standard and delivering that high standard of care for everyone that needs it.